Question 181, the answer is C. Cristae are found in the mitochondria. Question 182, the answer is D. The inferior hypogastric plexus lies in the extraperitoneal connective tissue of the pelvis. In males, it lies in the side of rectum, seminal vesicle, prostate, and posterior part of urinary bladder. In females, it lies on the side of rectum, cervix, and the posterior part of urinary bladder. Question 183, the answer is B. The joint which is shown in the picture is the first carpo-metacarpal joint. Let us look at the various joints of upper limb and their type, because any of them can be asked in MCQs. First of all, sternoclavicular joint. This is saddle. Acromioclavicular is plain synovial. Shoulder, ball and socket. Elbow, hinge. Superior and inferior radioulnar. Pivot. Middle radioulnar is syndesmosis. Wrist, ellipsoid. First carpo-metacarpal is saddle, which is asked in this question. Metacarpophalangeal, ellipsoid functionally, and structurally they are condylar. Interphalangeal is hinge. Intercarpal and midcarpal are plain synovial. Question 184, the answer is D. This is a muscle of the extremity. Biceps brachii is a muscle of the upper limb, and all the muscles of the extremities are derived from the paraxial mesoderm. Question 185, the answer is A. This is the nose. Behind it is the nasopharynx. This is the oral cavity, and this is the oropharynx. Now the gate or channel which forms a communication between the nasopharynx and the oropharynx is called the pharyngeal isthmus, or the nasopharyngeal isthmus. Whereas the communication between the oral cavity and the oropharynx is called the oropharyngeal isthmus. The oropharyngeal isthmus is bound by the palatoglossal arches. So, it is closed by the contraction of the palatoglossus muscle. The pharyngeal isthmus is closed by the elevation of the soft palate, which is by levator veli palatini or levator palati. And when the soft palate is elevated, it comes in contact with the passivant's ridge on the posterior wall of the pharynx, and this passivant's ridge is raised by the circular fibers of palatopharyngeus muscle. So the levator palati along with the palatopharyngeus help in closing the pharyngeal isthmus. Question 186, the answer is A. Mastoid tip is not present at birth. The rest of the structures, mastoid antrum, ethmoidal labyrinth and endolymphatic sinus, all these are present at birth. 187, the answer is B. The vaginal skin has no glands. It is lubricated by the mucus secreted by the cervical glands. Cervical glands and the vestibular glands. It is lined by stratified squamous epithelium, which is rich in glycogen. Question 188, the answer is B. For the branches of external carotid artery, remember Salfo PSM. S for superior thyroid, A for ascending pharyngeal, L for lingual, F for facial, O for occipital, P for posterior auricular, S for superficial temporal, and M for maxillary. These two are the terminal branches. Superior thyroid, lingual and facial are present anteriorly. Occipital and posterior auricular are present posteriorly. Ascending pharyngeal is present medially, and these two are the terminal branches. Question 189, the answer is D. Popliteus is a flat triangular muscle whose origin is tendinous and insertion is fleshy. Unlike other muscles where the origin is fleshy and the insertion is tendinous. The origin is intracapsular as it arises from the anterior part of the popliteal groove on the lateral surface of the lateral femoral condyle. Some fibers arise from the arcuate popliteal ligament and outer margin of lateral meniscus. The insertion of popliteus is in the posterior surface of tibia into the medial two-thirds of the triangular area above the soleal line. Nerve supply is tibial nerve, and the action is it unlocks the knee. We've already done this. It unlocks the knee by rotating the femur laterally during initial stages of flexion. We have done this in detail already. It flexes the knee and it retracts the lateral meniscus preventing it from getting crushed between the condyles of femur and tibia. So it retracts the lateral meniscus, preventing it from getting crushed between the condyles of femur and tibia. Question 190A. This has been discussed earlier. Question 191, the answer is A. We have already discussed the branches of medial and lateral plantar nerves and the muscles supplied by them. Question 192, the answer is B. Lymphatic flow is maintained by the contraction of muscles. Question 193, the answer is B. The spleen has red pulp and white pulp. Red pulp is the vascular part of spleen which contains the sinusoids, whereas the lymphatic nodules, including the eccentric arteriole, comprise the white pulp of spleen and they are made up of T cells. Question 194, the answer is A. The lacunar ligament is also called Gimbernac's ligament. The pectineal ligament is also called the ligament of Cooper. This is an extension of the lacunar ligament. And Poppert's ligament is the other name for the inguinal ligament. Question 195, the answer is D. Descending genicular artery is the last branch of the femoral artery. We did this when we talked about the branches of femoral artery. It arises just above the hiatus magnus. It divides into a superficial saphenous branch which accompanies the saphenous nerve, and a deep branch which reaches the knee by piercing the vastus medialis. The popliteal artery gives 5 genicular branches. The popliteal artery is a continuation of the femoral artery and it gives 5 genicular branches. Two superior, 2 inferior, and 1 middle. The middle genicular artery pierces the oblique popliteal ligament of the knee and supplies the cruciate ligament and the synovial membrane of knee joint. Question 196, the answer is A. The sensory supply to the medial side of the leg and the foot as far as the ball of the big toe is supplied by saphenous nerve, which is a branch of femoral nerve. Medial side of leg and foot up to the ball of the big toe is supplied by saphenous nerve, which is a branch of femoral nerve. Question 197, the answer is D. It separates the subclavian vein from the subclavian artery. So it lies between the vein and artery, thereby separating the two. Question 198, the answer is B. Question 199, the answer is C. The areas involved in the posterior cerebral artery infarct are Question 199, the answer is C. The areas involved in posterior cerebral artery infarct are the occipital lobe, inferomedial part of temporal lobe, postero-inferior part of parietal lobe, large parts of thalamus, midbrain, and the posterior part of choroid plexus. Question 200. The answer is C. Let us look at the boundaries of the Prasat's space. Superior boundaries formed by the fibers of lateral malleolar fold. Inferior boundary is formed by the short process of malleus. Lateral boundary is formed by the shrapnel's membrane. And the medial boundary is formed by the neck of malleus. So that was about the discussion of these 200 questions. Thank you.